Welcome to the Redemption Physical Therapy Podcast, the podcast that helps you move better, recover faster, and perform stronger. I'm Frederick,
I'm Marissa.
and today we are going over how to fix knee pain during squats. We'll dive into the common types of knee pain. We'll go into 5 different solutions, and then you'll have your comprehensive example on how to fix your knee pain during squats. All right, so let's get right into it. Starting off with the common types of knee pain.
I think the most common is probably anterior, so the front of the knee. That can be, in my opinion, two sources, right? It can be like a patellofemoral pain, which is more or less the actual kneecap. The patella is not moving correctly in its specific groove. There's a specific groove it has to stay in. Everything around it needs to be optimized or optimally moving in order for it to stay in that groove, and it's not doing that. That tends to be a little more of like that sharp, people complain of it like under the kneecap type pain, right? So that's
Okay.
our patellofemoral.
Okay.
The other one that's anterior, which is probably what people have heard of more, is that patellar tendinopathy or patellar tendonitis,
Hmm.
where the actual tendon, the right underneath of the patella, becomes inflamed or overused or irregular, whatever the cause may be. But they have that pain just underneath the kneecap, below the kneecap.
Okay. So with those two specific types, so now we go into the poor patella tracking. So that can be due to what now?
So that's more or less due to something, I look at the knee, I say the knee is a victim joint.
Hmm.
I say that because whenever someone comes to me with knee pain, I'm digging in and trying to figure out the root cause, which is not usually the knee in itself. Usually it's something happening below or above the chain that's causing the pain at the knee. So it's a
Okay.
little bit of a victim. So this patellofemoral pain, whereas the kneecap is not actually moving well in the groove, can come from a number of things. It can come from below the chain, something happening at the ankle.
Okay.
Maybe we're lacking mobility there or we're lacking control there. And of course, that lack of control is going to come up to the knee when we squat.
Okay.
Same thing at the hip. It could be a hip mobility problem or a hip control or weakness, glute weakness, which is very common problem that is not allowing the knee to track properly or to have proper movement mechanics going through the squat, which then pulls on the patella incorrectly and affects the way that it slides in the groove.
Gotcha. Okay. So it can come from down the chain
Yep,
or up the chain.
usually does.
Usually does.
Yep.
Got it. All right. So with that in mind, so what are some simple ways that you would normally address those things?
Yeah, so kind of digging, to see what is the most apparent issue, right, for
Hmm.
that person. If it's an ankle mobility problem, it's likely ankle dorsiflexion. So, like if this is my ankle, my ability to kind of go this way versus point my toes, right? So the
Okay.
dorsiflexion
So
is the
toes
opposite.
pointing up,
Yep.
going up instead of toes going down.
Correct.
Dorsiflexion.
Yep,
Okay.
exactly. So improving their dorsiflexion so that their knee can track over their toes, because contrary to some people's beliefs, we should be able to track our knees over our toes. We should be able to fully squat with our knees going over our toes without problems or pain, right?
Yeah.
So if I'm lacking that at the ankle, it's going to transfer up to the knee because we're going to have that weird movement pattern where our knee is not shooting over our toe the way it should during a squat.
All right.
That's more common than like an ankle instability problem, but you see it a lot in CrossFitters too.
Gotcha.
That dorsiflexion up in the hip, right? Same thing. It could be a hip external rotation problem, right? So kind of like my ability to drive my knee out, that's like a big thing.
Okay.
However, it can also be an internal rotation problem. So some sort of hip mobility issue because we also need internal rotation, believe it or not. And if that's the case, then we're addressing the hip mobility problem. And then very commonly, it's a hip weakness problem, usually of our glute med. So, which completely destroys our ability to control the knee, especially under heavy loads.
Gotcha. Okay. So it could be weak glutes in that control in the glutes It could also be the dorsiflexion, so you would tackle that with some type of ankle mobility drills there. So I see you also like there's some things going on in the hip flexors, the quads,
Mhm.
maybe tightness or weakness
Yeah.
potentially.
So, I use the term tightness loosely in a
Okay.
sense, right? So, I'm a firm believer that when we have, if we are healthy human beings, if there's no type of underlying disease process or something like that, right? A sensation of tightness is usually as a result of some sort of imbalance or a weakness, right? So a lot of people complain that they have tight hip flexors, right? And we used to believe, when you sit at a computer, for example, and your hip flexors are shortened, we used to believe that like that would cause tightness and they would shorten and then we'd have problems. That doesn't actually happen, but what does happen is that we get weak in our hip flexors, which contributes to this feeling of tightness, right?
Okay.
It's almost like a protective response of the body.
Hmm.
If you don't have the strength in a muscle to control movement, your body will limit that movement to a safe range. Okay, and then
Mm-hmm.
we feel it as tightness,
Got it.
right? So tightness in the quad and hip flexors, your quad actually attaches to your quad tendon, which is right above your kneecap, which completely uncovers the patella and becomes your patella tendon. It's all one chain, right?
Mm-hmm.
So if we have tightness up here and tightness, whether it's weakness or tightness, it's going to affect the way that the pull on the patella is occurring,
Okay.
right? So when we go down into our squat and we're actually further kind of lengthening that distal area, this over the knee area,
Hmm.
it's going to pull on that patella, forcing it to track suboptimally and then causing pain.
Got it. Okay. All right. So kind of moving into the next point here. So the common type is medial
Mm-hmm.
knee pain. So if you have pain that's on the inside of your knee. So what are some of the common causes of that there?
So a little less common, right, than anterior, but yeah,
Hmm.
medial knee pain can happen. A lot of times it's a knee control issue.
Okay.
So again, I'm looking up and down the chain always, right? And so some of these issues that are showing pain in different locations, they start to overlap.
Okay.
Okay, so medial knee pain, we think down at the ankle. You could have an ankle mobility problem, right? Because if I don't have enough dorsiflexion, I have to get the movement somewhere in order to complete the squat, right?
Okay.
Otherwise, I'm just going to fall over, right?
Hmm.
So if I don't have enough dorsiflexion, maybe my foot starts to pronate, or we think of it as like this collapse,
Okay.
right? Of course, that travels up the knee and causes that collapse, that medial collapse. We call it valgus,
Okay.
right? Which puts strain on that inside portion of your knee. Okay.
Okay.
So that's one reason. Okay. Coming up into the hip, a lot of times we see it if there's a glute med strength problem. You're not able to kind of control your knee and you're not able to really drive in that rotation, that external rotation, that drive your knee out cue that we hear,
Hmm.
right? So that'll also lead to that valgus that we talked about, that cave in of the knee, which puts strain on the medial structures, the inside knee structures, and causes pain.
Got it. So the same thing. So the ankle and the hip both can cause that knee to just collapse in
Hmm.
some during the loaded movements, which can start to wear away and cause a little bit of stress on the inside of that knee.
Yeah,
Got it.
absolutely. It's overlapping for sure.
Got it. And when we're saying like that pronation, if you don't understand like the pronation or even the collapse, is mainly like if you had a flat foot
Hmm.
compared to if you had an arch on your foot. So
Hmm.
pronation, flat foot, and that's what we're talking about there.
Hmm.
All right. Okay, so getting into the next one, lateral. So on the outside of your knee pain.
Yeah, probably the least common, but lateral. I think it probably gets categorized as this ilio or IT band syndrome, right? IT band,
Hmm.
everyone's heard of that.
Yeah.
It's kind of a garbage term in a sense.
Hmm.
It could be the IT band that's rubbing, right? Because that IT band comes and attaches along the outside of your knee.
Hmm.
So if there is some sort of issue with the IT band, yes, there could be friction there causing that lateral knee pain, right? Um, we used to think it was tightness, right?
Mm-hmm.
Come to find, we can't stretch the IT band. It's not
Yeah.
happening. The
Yeah.
amount of mechanical stress that needs to stretch the IT band is not, we can't do it, right?
Okay.
So it's not an IT band tightness thing that everyone thinks it is. A lot of times, this lateral knee pain that's IT band related is coming from the glutes. You've got
Okay.
weak glutes, right? You have
Yeah.
likely a weak glute med that is not allowing that proper tracking of the limb, the femur, the leg, the knee, everything, putting strain or friction through that IT band, and the rubbing causes pain.
Got it. Okay. So we're not
Weak
stretching
glutes.
the weak glutes. All right. Strengthen your glutes, people. Strengthen your
Yeah,
glutes.
right.
And you can get rid of 99.9% of your knee pain. All right. So weak glutes, weak glutes, weak glutes, ankles. All right. So let's get into the common solutions here, even though we hinted on some of them.
Mhm.
So the top 5 solutions that we'll go over. So the first one, strengthen your glutes,
Yep.
especially your glute med. What are some simple ways that we would go about strengthening the glutes?
So it depends on where the person is in their weakness journey.
Yeah.
So if there's someone that just really can't fire them, right? We first have to figure out the connection to fire them. It may not just be a weakness problem; it's that they can't turn the things on. All right, and that's where I might be starting like non-weight bearing, right? We call it open chain. Maybe I'm getting them lying on their side and they're doing the side leg lifts, right? So they're trying to feel that's not a strengthening exercise, by the way. That this is just a neuro re-education, right?
Yeah.
The clamshells,
Yeah.
they're a neuro re-education. You do not use them to strengthen the glute. It doesn't happen, okay? But it can help these people to feel what it feels like when the glute med is on, when it's firing, okay? So that's number one. Then getting them standing. If we can't use the glute med in weight bearing, how are we going to squat with 200 pounds on our back?
Yeah.
So getting them standing, banded fire hydrants, I love those, right?
Okay.
Those are a really good way to do it. And then really honestly, like incorporating anything single leg, like single leg RDLs, single leg deadlifts, single leg step ups, and really focusing on one, that glute med contraction, but that kind of screw in effect that we talk about. If I'm planted and my feet are here, I want to think of screwing my feet into the ground, and that will turn on my glutes. Right. So when you're doing these single leg exercises, thinking of that will help to fire that and start to be able to strengthen those.
Gotcha. So I kind of think of it as more of you're getting them to actually coordinate more appropriately throughout the movement instead of them not knowing exactly what they should be doing during that movement.
Yeah, for sure. Yeah, like getting the glute, because the glute med isn't the only glute, right?
Yeah.
But it has to work well with the glute max, which is like the bulk of your butt cheek, right? So it has to work well with that. It also has to work in unison with your quads and your hamstrings, and so everything, it may not be that they are weak. It may just be that they don't know how to coordinate 14 muscle groups because they've compensated over the years.
Yeah. And we'll dive into that a little bit more as we go into the other ones of how you can actually improve that, because I was thinking about just slowing the movement down. A lot of times people get into exercise and they're just trying to bang through their movements, and they don't actually train the coordination, the control, and allow the body to actually feel out the whole entire movement, because the speed of movement definitely determines on what muscles are actually kicking in throughout it. It's like if you were jumping, you're going to have a lot more of your bigger muscles kick in, comparatively speaking, to if you were doing a nice, slow, and controlled squat. But to the next point, we got improve ankle dorsiflexion is the next common solution here. And we kind of hinted at that. So what are some common ways to improve that?
One of my favorite is just like the banded ankle dorsiflexion mobilization, which can be found on our exercise library on my YouTube. But you set it up, you put your foot up on a box, you've got a band around your ankle, and you're driving your knee over your toe, right? So what it's doing is basically gliding the ankle the way that it's supposed to glide during dorsiflexion, right?
Right.
So the band's assisting that, especially if it's like a joint sticky restriction.
Hmm.
So that's one of my favorite drills.
Yeah.
But then ultimately just kind of utilizing your dorsiflexion in other ways, right? Like maybe I'm standing on, like, I stack two plates and I'm doing like baby heel taps or like step downs where I'm utilizing my dorsiflexion. Of course, you have to be very aware of the movement pattern. You have to
Hmm.
slow it down and be aware of your pattern. But just utilizing the dorsiflexion in functional ways is a great way to improve that as well.
Gotcha. Okay. And then I would say like another thing to just think about would be if you just got into a split stance into a lunge, and then you just started to practice driving that knee forward
Yep.
over your toe just to understand what that sensation's like. And then see where you're restricted, like how much restriction you actually have in
Yeah.
that position from just doing that thing. That's also just another easy way to add that in, right?
Yeah. Shit doesn't have to be complex like
Yeah.
Instagram shows it.
Yeah, right.
Like they're standing on like a Bosu ball, like on a unicycle with like, it's like, what are we doing?
Yeah.
What are we doing?
Yeah, it doesn't have to be that complex. It just may take
Right.
a lot longer than what you think it may take. Sometimes,
Yeah.
and this is where we kind of get mixed up because sometimes we'll do a solution or intervention and then we'll see dramatic results.
Yeah.
You're just like, oh my god! So all I got to do is just what's the next thing I need to do in order to prove this? And then it doesn't work the same way
Mhm.
because sometimes it can be a quick fix and sometimes it just may take a lot longer for the body to finally open up or for us to finally like strengthen another area that was a little inhibited and then also add the mobility into the other area that was a little restricted, and
Mhm.
then that combination over maybe even months starts to show up in your training.
Right.
You start to see those improvements. I've seen that plenty of times with quite a few people that I train.
Yeah. Yeah, and it's, the quick fix is a green flag. That's great. It means that we can do something to change
Hmm.
it, which is awesome. But in order to promote those long-term changes, that's where we have to couple mobility with strength training, right?
Hmm.
Because we already talked about the fact that, like, you have some mobility restriction because it's a safety response. You
Hmm.
can't control the movement outside of that. So the body's like, I'm just not going to let you use it, right?
Hmm.
If we gain the mobility and then we follow it up with stability or strength training, so we start to train the body to be like, hey, I can control this range of motion, it'll let you have it. And that's where you start to get long term effects.
Right. So true. So true. It's that's one of the biggest things I talk about when it comes to the shoulder, just having good scapular stability before you even think about trying to like open up that shoulder even more.
Yep.
Because that's from my personal experience myself. I thought that I just had really bad shoulder mobility. In reality, like I could get my arms up overhead. It was my scapular stability that was the issue. I remember I had a coach and he was implementing a lot of different carries, overhead carries, single arm overhead presses. And then I remember going to do pull ups one time at like throughout a superset of doing those things. And I was just like, what in the world? This is the strongest and most stable I've ever felt doing pull ups. I didn't feel any awkwardness in my shoulder,
Hmm.
and there was no mobility work that we were doing. It was just all a lot of scapular stability work. And that's when the light bulb really, turned on for me. Other than just theory of being like, yeah, we want to be stable in this area so we can improve mobility, but actually feeling it myself was okay. I'm sold. Like,
Yeah. Yeah. This makes sense now.
like this makes sense now.
Yeah.
So yeah, making sure that we're stable in certain areas of that chain in order to allow the freedom or the proper movement mechanics down the chain too.
Yep. Yep.
All right. So getting into the next point, we have improve hip mobility. So another common solution to squatting without knee pain.
Yep. I love banded hip mobility, and there's so many ways that you can do banded hip mobility, but in general, you tie the band on a rig, you place the band, your foot in the band and high up on the hip crease, and then you go through specific movements, right?
Hmm.
The reason I like banded stuff is because what it does is it like gaps the hip joint, right?
Hmm.
So it kind of gives us some freedom of movement, and then whatever specific movement we're moving into or out of, it allows that to happen, right? So that we kind of gain a little bit of mobility at that point. Um, an important thing to note with the hip, with the mobility of the hip, as functional fitness athletes, we emphasize external rotation, which is
Hmm.
important. Don't get me wrong. Our ability to drive our knee out, that type of stuff. it is not the only thing that we need. We need internal rotation too, especially when we're going like ass to grass in a squat.
Mm,
If we're not able to internally rotate to maintain the contact of the joint in the actual hip joint, then we're going to get it somewhere else, right?
mm,
So if I'm not internally rotating at my hip, maybe I'm collapsing at my foot in order to get that rotation.
mm.
Maybe my knee is caving in and now I have this medial knee pain in order to get that. Your body will get it somewhere. Is it going to get it from the correct place? Maybe not, especially when the correct place is not functioning well. So internal and external, both can be banded, but yeah, internal and external, and then always following up. I love to follow up my hip mobility stuff with something single leg that's forcing that hip to find its place in space
Mm-hmm.
and strengthen within that.
Got it. Okay. And one of my kind of favorite little things to add into that one when it comes to hip mobility that's pretty simple and a lot of people just kind of avoid it is actually sitting in your squats.
Yeah, yeah,
So just pausing in the bottom of your squats. If you want to pause for 1 second to 3 seconds, pausing in the bottom and just allows your body to actually understand, oh, wait, I'm okay in this position. And it starts to learn that position, control. And control is another reason why we end up getting tight, right? Like we just said before. So if we can sit in those, we spend more time in that position and we gain range
yep,
over time. Like you could, if you simply just did that, if that's if it's more so an exposure issue, you simply just 3 seconds in the every single rep of my squat, and you did that for an extended period of time, you'll already start to see improvements in your mobility
yeah,
in your squats from just doing that one simple thing. All things being equal, making sure that you do have your knees tracking in the right alignment and everything like that, and your feet aren't collapsing in. So all things being equal, nice, good, controlled squats, holding in the bottom. That's one very simple way to do it. And then just changing up the loading
yeah,
also. So that stacking, that rib cage stacking is a huge thing because I have that issue. Whenever I would do back squats, it would be a lot more challenging for me to sit deep into a squat compared to if I did front rack stuff. So front squats or even goblet squats, front rack loaded kettlebell squats, Zercher squats, anything front loaded allowed me to be stacked more appropriately. So I was able to actually sit down in a really deep squat from there. And that's how I helped one of my clients that had a issue with getting into deep squats too. Older gentleman, so he definitely built up a lot of tightness and resistance, and he wanted to do overhead squats. And I was just like, man, first we need to actually make sure we get into a deep squat first and foremost. So I gave him Zercher squats, and he was able to. So before he could only get to about parallel with back squats, and then once I gave him the Zercher squats, he was able to actually get below parallel, and this was without doing anything else. So just giving him a different squat variation allowed him to get into a deeper squat.
yeah,
And we just did that over time. Caution here is because you are doing loaded into a position that your body may not be prepared for, you got to be cautious about how much load you add onto that because then you can get a strain from overstretching tissue that isn't actually ready for that loading. All right. So getting into the next point here, number 4, tempo.
yeah. So you kind of touched on this a little bit earlier. So adding tempo to a movement, right, can has other strength training benefits, right? But it also forces you to be more aware of your positions. So if it is a positional issue, or
Mhm.
something like that, slowing the movement down, utilizing the correct whatevers that we weren't utilizing before, your glute med, maintaining an arch, something like that,
Mhm.
really forcing them to be aware of those positions can be all that they need. It could just be that they have the strength to be there. They're just not aware of the poor movement patterns that they have.
Mhm.
And that, there's another real good way to do this is to film yourself as well.
Yeah.
So that visual feedback is important because again, we are great at compensating and we don't even feel it happening.
Mhm.
I'll be coaching a class and I'm like watching them squat and they're done and I'm like, "Do you have a left hip problem or something?" And they're like, "No, why?" And I'm like, "'Cause you're shifting to the right like a lot." And they're like, "I am?" I'm like, "Yeah, like significantly." So I'll videotape them. They're like, "Oh my God, I don't even feel that. I don't even feel that." So like, especially going through these tempos where the emphasis is position and
Yeah.
control, have some sort of visual feedback,
Yeah.
unless it's from a coach or something. But if you're by yourself, videotape it. I know it
Yeah.
sucks to watch that, but again, it'll help you to kind of to figure out that awareness.
Yeah, definitely. Because it's funny that she says that because I didn't realize that I had a hip shift until I was squatting in front of a mirror, and I ended up going into a different gym, and they had mirrors right in front of the squat rack. I did not like it.
It was a glow gym, wasn't it?
No names, but I didn't like it. But I got used to it nonetheless by just looking down. But the couple of times I did watch myself squat, I did see that I had a hip shift. And then that's when I actually sought out you to actually help me out with that. And you were just like, oh, man. And we did some scraping and cupping or whatnot to my adductors, and then some internal rotation work and some external rotation work. And sure enough, like we remedied that issue. But again, it came from the feedback of actually seeing myself.
Yeah.
In order to know that that was an actual issue for
Yeah, it was
me.
yeah.
Because I would have just kept squatting, and my squat was pretty strong around that time, so I didn't think anything of it. I
Yeah.
was just like, oh, okay, whatever, cool, let's keep going. But yeah, that was a very good point, and I have experience with that one.
Yeah.
All right, and then to the next point is, and the final one is modify training volume, intensity, positions, etc. So modifying.
Yeah. And I think, we talked a little bit about like patellar tendinopathy in the first piece here, which is often an overuse problem. There can be things going up and down the chain, of course, right? But sometimes just simply modifying your volume or your intensity, or maybe we do box squats instead of full range squats for a certain period of time. Sometimes that modification can help clear some things up, or just simply allow us to work on the things that need to be worked on. So if we're doing everything for the hip, we're opening it up, we're stabilizing it, we're doing all these things, and then we go to squat and it just falls apart. Well, maybe we take away that full depth for now. Maybe we just train the hip into parallel box squat. Okay, once we've got it down, then we lower the box a little bit. So that's one example of just modifying it to meet you where you are, right? Meet you in your journey, versus forcing something to happen, because it's not going to happen immediately, right?
Yeah.
So yeah, just training I think you're probably a better person to even talk on this, is changing your volume and your intensity, like adding in different volume rep schemes, intensity throughout your program can make a world of difference.
Yeah, for sure. The training volume, that's a huge one, because that's like my go-to with the clients that I just generally train for performance or just general longevity, is that we want to start with the minimum effective dose, right? We don't go out the gate looking at, all right, let's go ahead and we're going to do 4x10 on squats on Monday, 4x10 on squats on Thursday. And then, we start with the minimum effective dose, but reducing your training volume overall. So there are multiple ways to reduce training volume, and some of the ways are reducing training days. So if you're training 6 days a week, we're laughing because Marissa trains 6 days a week, folks.
I'm doing better.
She's doing better. She's doing better with her volume management. That's why she said I'm probably better at talking about this.
Right.
Believe me, I went through that phase too, where I wanted to train all the time, but I learned from actually breaking my body down. But anyway, just reducing your training days, right? So reducing your overall training days. So maybe you'd be like, okay, I need at least 2 rest days. So that's reducing your overall training volume, and then you allow your body some time to recover and adapt, and then be able to come back stronger, or at least at a good baseline to where you're not actually breaking your body down more. The other way is to reduce the amount of exercises that you have in that session. So specifically talking about the squat, if we're doing squats, let's just say 4x10, but then we also do lunges and we do 4x10 on those as well, maybe reduce that to taking it down to half of those lunges. So we're doing 2x10 instead of 4x10 on each leg. Or we just completely eliminate the lunges altogether, because we're going to be squatting 2 days a week anyway. That's another way. So reducing the number of exercises, and I already kind of just hinted at reducing the number of sets as well. And then you can go with reducing the overall volume of repetitions that you do. So if it's more of a muscle endurance thing to where you're doing 3 sets, or let's just say wall balls, for instance, if you're doing at the end of your workout, you're doing 4 sets of 20 unbroken wall balls just to try and build up that volume and that capacity. Maybe it's just like, okay, let's start a little bit lighter, or each set we're going to do 3 sets or 4 sets of 15 instead, or 2 sets of 15 unbroken, whatever it may be. But there are a multitude of ways to reduce your training volume, and you want to see which one actually works best for you. If you feel like you need to be in the gym, okay, you may want to work on that. But if you feel like you have to be in the gym doing your workouts or whatnot, then maybe not reducing the days is not the thing for you. Maybe reducing the number of exercises within that session, maybe reducing the number of sets in that session would be the way to go for you. But reducing your overall training volume can be done in a multitude of ways, but that's going to be one of the biggest factors in improving your readiness and your body's ability to deal with the next set of stressors that's going to come for that area. And then, like you said, with the positions, so just the modifications there, and I kind of hinted at it earlier too, just about just the different loading. So loading in a different way. I know some people that you may actually be a little bit weaker in your core, so not being able to stabilize appropriately through your core. So adding a movement, a different squat pattern that makes you utilize that more or make you more conscious of bracing your core is another great way to do that. So adjusting the positions based off of that and adding in those little tweaks, like adding bands to your knees or adding a band to your hip to get that full hip extension at the top.
Yep.
There are a multitude of ways to do that. I remember one client that I had, she had a hip shift as well.
I was like, yeah, did you use a band?
I had a band, yeah. And honestly, I was just like, okay, if I'm not here, what is a way that I can, give her this exercise? So we just put a band around a stable pole and then just put that band around her hip. So the band is pulling her into that dysfunction.
Yeah.
And she had to squat with that without moving into that dysfunction. So I had heard it a long time ago from one of my coaches, and he called it feeding the mistake.
Yeah.
So you just kind of feed that mistake with that band tension. So that way it's kind of like, okay, now I'm more aware of what's going on.
Right.
So that was a pretty cool way of first learning the concept and then utilizing that concept and seeing it actually have major effects.
Yeah.
Within that same session. And all
It
it
is
was
fun
was
to
just
get
awareness.
creative.
Yeah.
For sure.
Anything else to add on that one? Modifying training volume?
No, I think you hit it well. Like I said, I think it's there's so many ways to do it and to be patient, right?
Yeah.
So it's like, so maybe the way, the decrease in the sets didn't improve anything for you. Okay? So now we're looking into maybe modifying the position or something like that. But you do have to allow time for these changes to occur.
Yeah.
If it doesn't just, if the first week you're like, well, that didn't work. Well,
Yeah.
you gotta allow a few weeks of each one. You gotta kind of adjust as you go in order to figure out what modification is best for you.
Yeah.
Yeah.
Definitely. And I think that's a big thing that people run into, like a problem that people run into, is because we want to get back into our training as soon as possible. Believe me, I get it, because that's how I like. Not being able to train because of whatever may be going on, like, it's tough, especially if you know what you're capable of and what you used to be capable of. And then also you have a lot of people training around you.
Yeah.
That's tough. I get it from personal experience, but understanding that it's going to be easier to slowly progress forward than it is to have to take a multitude of steps back because you ended up injuring yourself because you didn't take the proper precautions, or you came back a little too soon, you injured yourself, came back again, bigger injury, and just keep going through that pain cycle. So in order to break that whole entire pain cycle, we have to approach it, with a smarter approach, basically.
Yeah.
Yeah. So that pretty much wraps it up with that one, folks. So again, if you have any questions about anything that we discussed over this podcast episode, feel free to put them down in the comment section below, and we'll make sure to get back to you. And then we'll also use that for future episodes as well, so that way we can actually put out the information that you're actually seeking. Okay, so don't feel ashamed or shy or afraid to actually put something in the comment section, because we actually will get back to you. All right. So if you want to learn more about how Redemption Physical Therapy can help you get out of pain and take your performance to the next level, be sure to go to redemptionphysicaltherapy.com or simply click the link down in the show notes. Thank you again for listening, and we'll see you next time.